traditional biomedical model of health and illness. What does it mean? Meaning the development of the disease and the interrelations between disease and health condition. On 20th century, due to development of science, due to development of technology, there have been some changes in perspective of health psychology as well. So in 19th century, it was a basis, of the medicine and the concept of a man. Please do not forget about Darwin theory of evolution. In this context. There was a concept of a man, and a man was in a place within nature. So a human was studied through dissection, physical investigation, and medical examinations. In 20th century, there has been mentioned several challenges for biomedical model. Why? First of all, because of novel theories in psychology. If you know famous and one of the most outstanding psychiatrist and scientist, Sigmund Freud, and his analysis of the relationship between mind and physical illness, and also studies of his student Carl Jung, and he also made a great contribution in the development of health psychology. Concept of psychosomatic medicine in the beginning of the 20th century, it was a first challenge for the biomedical model. And the second challenge was sorry, someone call it. Do you have any questions? Because I've seen someone. Okay. And the second challenge was behavioral health. So maintenance of health and prevention of illness by changing behavior and lifestyle. So we can correlate nowadays these, and I will give you examples of behavioral changes, how behavioral changes can affect the oral cavity health condition. Maybe you can give me some ideas about it. Maybe you can text in the chat how behavioral changes can affect oral health cavity health condition. I will I will put on microphones.
Depression can cause someone not look after themselves, not take care of their body and stuff like that, and then they're just not motivated to like brush their teeth and do basic hygiene, so that can affect the.
So depression, what does it mean? When a person doesn't care about oral health, doesn't maintain proper oral hygiene, and this leads to development of some heart tissue diseases, for example, right? Okay, so let's continue. And behavioral medicine, it was the third challenge that includes element of psychology, sociology, and health education. And this also focuses on the treatment as well as on prophylaxis. What's next? So the health psychology that is used nowadays, yeah? This is one of the most recent development of psychology. It includes psychology into understanding the health, and it challenges the mind and body split and the role of the mind in the cause of and treatment and development of the disease. And this is most specific to the psychology. So let's compare now biomedical model and health psychology model. So if we consider what causes illness, meaning etiology of the disease, in traditional biomedical model, there were several options. For example, external factors like bacteria, viruses, and also internal factors. For example, metabolic imbalance, it's congenital disease, right? Or genetic predisposition. In health psychology, it was another attitude and concept. It considers humans as a complex system, as a complex body, and illness might be caused by a combination of biological, psychological, and also social factors. So it's a complex of factors that can influence on the development of the disease. So, who is responsible for illness? In biomedical model, individuals are passive victims of some external causes. However, in the concept of health psychology, individual is responsible for health and illness. So we are taking into consideration the role of behavior. And I will give you an example. For example, you have a patient, a teenager, and he or she wants to have a beautiful smile and beautiful aligned teeth, and you are planning treatment on fixed appliance like braces. Of course, one of the most important factors is to maintain proper oral hygiene, especially when patient wears fixed appliance like braces. And of course, you have to educate and explain how to maintain this proper oral hygiene, right? Because it takes more time, yeah, cleaning, brushing not only the teeth, but brace space. So there are special brushes for braces, there are special appliances for it, yeah, and also it recommended to use irrigator, yeah. And without proper oral hygiene, it's a high risk of development of caries, especially if it is a teenager. But as we know, during growth, there are two, let's say, breakthroughs when we can start, when the treatment goes with the best outcome. It's during 6 till 8 years old, and then during teenager period from 12 until 15 or 14, yeah, when it's a growth of the whole body and systems, right? So you can influence on growth and you can treat with the best outcome possible, yeah, during growth. So that's why it's advisable to start treatment during teenager period. However, there are risks if your patient doesn't maintain proper oral hygiene. So the risks will be development of hard tissue diseases like caries and also juvenile gingivitis. This is also very, let's say, it's more and more, developing in a period of teenager, juvenile gingivitis. It's a swelling of gingiva, sometimes bleeding. Mainly it's because of hormones changing and also not proper maintaining of the oral hygiene. And of course, you explain your patient the rules, and procedures to maintain. But if patient doesn't follow your recommendations, so there are risks of development these diseases. So this is patient's responsibility to maintain proper oral hygiene, right? So this is your dual cooperation, you as a doctor, as a dentist, from one hand, and from the other hand, your patient. So that's why it's very important to build your connection, the trustful interrelations between you and patient in order to achieve your common goal. So you as a doctor have to communicate not only with the patient, to find the language, the proper language of communication, but also with the parents. So this is one of the example of behavior patterns and changes that might affect the treatment or the outcome after the treatment. How should illness be treated? So in biomedical model, there are several options. So it's a vaccination, it might be surgical intervention, it might be medical treatment, radiotherapy, chemotherapy. So all methods change physical state of the body. In health psychology, there is a holistic approach. So meaning taking into consideration different options and putting them under one umbrella. It is a medical recommendations, there are behavioral changes, and also encouraging changes, explaining patient or explaining patient's caregivers. So it's a more holistic approach. So taking into consideration not only medical interventions, but also psychological aspects.
Excuse me?
Yes?
We cannot see your presentation.
You cannot see my presentation?
No.
And you just text me?
Yes.
Oh my God. I thought you... Okay, let me try again. Salome Akhar. So, I will stop presenting now and I will put back again, okay?
Okay.
Text me. Yeah, can you hear me now?
Yes, we can hear you.
Yeah. Okay, so I stop the presentation. I will put it back, okay?
Okay.
Mm-hmm. Can you see now the screen? My screen.
Yes.
Health psychology, it's written here.
Yes, yes.
You can see biomedical model and health psychology model. Can you see now?
Uh-huh.
Please, ladies, confirm.
Yes, I can see it.
Okay, okay. So we continue, okay? So who is responsible for the treatment? In biomedical model, as far as it can maybe forecast, medical professional is responsible. However, in health psychology model, patients is responsible for their treatment as well as medical staff. Yeah. So again, cooperation. Yeah, and understanding each other. It's very, very crucial and important. So relationship between health and illness. In biomedical model, health differ from illness, and an individual might be either ill or healthy. So two states of the health condition. In health psychology, we take into consideration again in another way. So health and illness, they exist in a continuum. And individuals progress from health to illness and vice versa. So there might be periods of regression and periods of improvement of health. For example, if your patient suffers from aggressive form of periodontitis, yeah, it's a chronic disease and very aggressive, and usually young patients are threatened by this disease. And of course, yes, it might be treated, but there are periods, yeah, like curves, that are going up and going down, yeah. And so this is patient, of course, have to maintain, patient have to visit periodontologist at least twice per year in order to maintain health condition and check the periodontal status. So this is a strategy that should be followed both by dentist and by patient. A relationship between mind and body. So in biomedical model, there is a dualistic model. So it's a separation of mind and body, and they function independently of each other. And mind is considered as an abstract and related to feelings and related to thoughts and emotions. In health psychology model, there is an interaction between mind and body, and there is influence of these two entities and influence on each other. Again, I will give you one example. A little child that starts going to school, yeah, first grader. Just in the beginning, before school starts, if child comes for a general checkup, the health condition might be, I mean, the condition of the oral cavity and hard tissues might be okay, without any cavities, without caries, so on and so forth. But sometimes the school might be so stressful for the child that it might appear because of stress, because of changing environment, because of changing behavior. So you name it. There might be different reasons of it. In couple of months, this child might have several caries, so meaning that the percentage of increasing of heart tissue diseases, it's obvious. So give me a moment, please. Yeah. This is one of the recent examples of how. I'm sorry, Ладо, телефон, пожалуйста, оставляй здесь. Здесь. This is one of the examples of how emotional status, yeah, and psychological status can influence on the development of oral cavity condition and diseases. Role of psychology in health and illness. So in a biomedical model, illness might have psychological consequences, but not psychiatric consequences. I'm sorry, I have to correct here the word. In health psychology, psychological factors are consequences of illness. So they are contributors of the development of diseases. So there might be direct impact of it and indirect, yeah, through behavior patterns or through stress factors. So what are the aims of health psychology? So it's an understanding, explaining, developing, testing theory, and putting this theory into practice. So you, as a healthcare providers, you have to not only to treat the diseases of the oral cavity, you have to find way to communicate with patient. You have to find to tune behavior and to solve it in order to achieve common goal, right? So this is very, very important to communicate effectively with the patient. So you will understand and you will evaluate the role of behavior in development of the disease. For example, if patient is a smoker, this is a very, very big problem in the development of soft tissue diseases of oral cavity like gingivitis or periodontitis. Diet, what are the meal patterns of the patient, so lifestyle, alcohol intake, drugs, of course, you understand it. So lack of screening or health checkups. Of course, you have to explain your patient that it's necessary to at least to visit dentist twice per year in order to maintain professional oral hygiene, and to go through checkup. So predicting unhealthy behaviors. A patient might have certain patterns or behavioral patterns or about certain beliefs about health, and illness. So that's why you have to communicate and explain, why it's necessary to change this behavior, why it's necessary to transform attitude towards this. Evaluating. Okay, all good. I just checked messages. Okay. So understand the role of psychology in the experience of illness. So helping to alleviate the symptoms. And evaluating the role of psychology in the treatment of the illness. So meaning psychological factors that can help in treatment by changing behavior, by changing beliefs of the patient, by changing attitude of the patients towards different patterns. So by implementing this strategy, you will promote healthy behavior. Yeah, for example, smoking cessation. Yeah, you will explain patient, and I wish you the best of luck in this. For example, that why it is necessary to stop smoking. Yeah, and preventing illness. So changing beliefs, behavior, modifying stress, training your, for example, assistant, yeah, health professional in order to educate patient how to properly brush teeth, for example, yeah. And there are different methodologies of health psychology. There are quantitative methods using surveys and randomized control trials and case controls, and also qualitative methods in order to assess the effectiveness of this methodology. Here we are talking about interviews and using focus groups, for example, group of people that later they're evaluating and analyzing their patterns and beliefs. So clinical health psychologist, this is separate medical profession. So clinical health psychologist works in the field of physical health, stress and pain management, rehabilitation for patients with chronic diseases, for example, cancer. Yeah. And development of interventions for some problems after surgical interventions or after severe neurosurgery interventions. I can tell you from my experience, yeah. So there might be there might be a cancer of that located in the area of in maxillofacial area, and usually it's a let's say teamwork of maxillofacial surgeon, neurosurgeon. So usually they work together, and ENT also specialists. They work together. So very often maxillofacial surgeon works within field, yeah, of surgical cancer diseases and treatment interventions, and after surgery and after treatment. Usually these patients, they need psychological support, yeah. For example, if the half of mandible was removed, yeah, and or maxilla, it's a very long process of rehabilitations and replacement. And of course, patients, both patients and their family members, they need this support. I just gave you one of the examples. I'm not talking about injuries of the skull, where sometimes the brain can be damaged, and of course neurosurgeon and maxillofacial surgeon, they work together also there in that case. So do you have any questions so far? Because now we will speak about screening. Let me check the chat. So no questions, yeah? Okay, give me an example. I would like to drink a little water, okay? Because I haven't taken the... So. Эти все, они все пыльные. Я их утираю. Значит, она сейчас тряпку и вытри, пожалуйста, еще раз. I'm here. So let's start to talk about screening, okay? Very trendy question now about screening, taking into consideration that the time that we are living now in the period of pandemic, screening is very, very important topic to consider. So based on World Health Organization definition, screening is the presumptive identification of unrecognized disease or defects by means of tests, examinations, or other procedures that can be applied rapidly. So the process by which unrecognized disease or defects are identified using tests that can be applied rapidly or onto large numbers of people. So screening tests distinguish apparently healthy people from those who probably have disease. Later on, I will show you the chart and you will understand what I'm talking about. So screening is the preliminary examination, and usually it's not diagnostic and it requires appropriate investigative follow-up, to meaning further investigation, right? And further treatment. So this is the picture. So can you see here, we are talking about big number of people, So they go, can you see here the circle? This is screening test here. Can you see? And these big amount of people, they go through screening tests, and there are a certain amount of people, So percentage with a positive result. And after that, these persons, they go for follow-up, So they might be advice or support based on follow-up and based on further investigation. They might be proposing treatment, or there might be no further actions. So there might be 3 outcomes after following up and after further investigation. So advice and support, treatment, or no actions. What are the examples of screening tests? So it might be mammography for breast cancer. It might be alpha-fetoprotein blood tests and ultrasound scans for pregnant women. Psychological tests to identify early signs of cognitive decline. Pap test for detecting cervical cancer. Screening for metabolic syndrome. In dentistry, there might be screening. For example, a group of dentists and assistant they go to school and examine all the students there. And there might be certain percentage of students with caries, with pulpitis, with soft tissue diseases, depends on age, So usually they're grouped by age. This is one of the examples. So what are the requirements? Sorry. What are the requirements for the screening? So acceptability for those whom the test is designed, they agree to be tested. Sensitivity to detect a target condition in those who have it. and specified. So the test gives negative results on those that are free of the target condition. So this is the chart explaining. So population, people, so they go through screening test. It might be positive result. Then if it's positive, we go through further investigation, right? And there might be 3 outcomes, as I told you. So if it's a no further actions, yeah, no disease, or it might be treatment or advice, yeah, in case something, for example, was recognized. If it's a negative, there is a probability that this is true negative or false negative. There might be percentage, yeah. So that's why it's necessary to go through regular checkup every year in order to check your health condition, yeah. And very often insurance companies, they imply certain amount of penalties if the patient doesn't go through regular annual checkups. So, what are the characteristics of a good screening test? So, first of all, it must be valid. For example, it must be sensitive and specific. It must be reliable, so it gives consistent results without random errors. Yeah. It might be yield, so meaning number of cases identified per 1,000 screened. So very important, the follow-up services must be included. So there might be a certain plan how to deal with positive results. One of the examples from our university. So our university provided screening test, mammography test, in order to detect breast cancer. And this program was implemented in different regions of Georgia. And it was free of charge for Georgian citizens. And after mammography test, if it was necessary to follow up, these patients, they could refer to hospital, New Vision University Hospital, for the follow-up and for the further recommendations. So this is one of the example of a system that provides screening, yeah, of mass screening of population with follow-up services, yeah. Because at hospital, if you know, they provide specialized treatment for the breast cancer. So this is one of the examples. Cost benefit, compare costs avoided due to early detection of the diseases. So against cost of the screening. Yeah, it's also important to consider. So when should we screen? So it is an important, so when? Yeah, when it's an important health problem. Nowadays, I think you agree, yeah? It's important to be tested, but now it's a period of uncertainty because this is a novel virus and some of tests, they are not 100% true results. So it is in a process of designing the tests, yeah, the rapid tests of this disease. So there is an accepted and effective treatment. The disease has recognizable latent or early symptomatic stage. There are adequate facilities for diagnosis and treatment, yeah, for example, for follow-up services. So there is an accurate screening test and there is agreement between the patient, yeah, and the entity that provides these services. So what are the types of screening? So there might be mass screening that involves screening a large population. For example, X-ray in order to detect tuberculosis. The multiple screening involves use of several screening tests on the same occasion. One of the example is annual health checkup. Targeted screening, this is a screening of groups with specific exposures, for example, because of occupation, yeah, working in a specific region, yeah, or specific environment. That's why it's necessary to screen these group of people for specific disease that might appear because of effect of this work environment, for example. Case finding screening is a form of screening that restricted to patients who consult a health practitioner for some other purposes. So next, this is so the ethics of screening. So the basic ethical principles of screening, there are autonomy, non-maleficence, justice, and beneficence. So these are the 4 ethical principles of screening. When we talk about screening, we have to remember that these all procedures, they are invented in order to prevent or to detect disease at early stage. Because, remember, it's better to prevent disease than to treat. If the disease is recognized, it's better to treat disease at the earliest stage than the later stage. I think you agree with that, yeah? So the purpose of screening is to detect at the early stages the development of the disease, yeah? And hence help patient to cope with this condition. So primary prevention, this we mean modification of risk factors. What are the risk factors of development of this, for example, particular disease? And here, for example, when we go through targeted screening and we know that for some certain occupation workplace, there is risk of development particular disease, yeah? And how we can modify the risk factors, how we can decrease the possibility of this disease, yeah? So this is the link between modification of risk factors and targeted screening. Secondary, detecting illness at the asymptomatic stage of the development so that the progression can be halted or retarded. And tertiary prevention refers to the rehabilitation of a patient or treatment interventions once the illness has manifested itself, yeah, when the symptoms already manifested. What are the psychological predictors of the uptake and to go through screening? So it's a patient's factor, it's a demographic factor, patient's beliefs, yeah, lifestyle, emotional status, and health professional factors. Physicians' beliefs about screening and the way they explain why it's necessary to go through screening, communication skills of healthcare provider. So these are 2 factors, psychological factors from both sides that we have to consider, yeah? And that's why it's necessary to train healthcare providers for how to properly and effectively explain patients the importance of screening. So what might be the possible problems in screening? There might be problems considered with ethics, yeah, with cost, with finances, and possible psychological effect. When the patient faces with false positive or false negative effect. That's why it's necessary to check again. So, do you have any questions? Text me, please, if you have any questions, because we will start now another topic, history. No questions. Okay, so I need time, just a couple of minutes to open another presentation, okay? Okay, so I will tell you, I received several mails about study material. So this I will explain. This subject is composed of different sections. I will give you the very first 3 lectures about introduction and explaining the main concepts of dentistry and health psychology, screening, and history. The other sections you will have with Mr. David and with Mr. Jacob, and they are topics about ethics and about communication skills. So regarding preparation for the midterms and for the final exam, on my behalf, the information from the slides is more than enough. And but you have to ask about other, let's say, lecturers, yeah, and study materials, Mr. Jacob and Mr. David. Yes, I will share with you all the materials. I had little problems with my laptop, and you know, and I think you understand that we are all blocked at home, and it's a little bit hard to go out and to repair the laptop. So I already fixed it, and I will share with you most probably tomorrow the PPTs, okay? I just need a time to repair the laptop and to fix everything. So I had permission to go out finally. Okay. So let me open another presentation. By the way, are you all in Georgia or you are spread around the world? UK, Georgia. I see. Yeah, you are all with your families, yeah, united. That's so sweet. Take care, and stay at home. This is the most important guidelines for us, yeah. So let me open the PPT. So we will talk about, we will have briefly, we will go briefly through history of medicine and dentistry through ancient times. We will start with ancient Egypt, and then we go to Greece, and maybe to India. Yeah, we'll go to India also. So what I would like to highlight and explain you, what are the main patterns that are followed in throughout the ancient times. The most important factor that are followed, through the ancient times and history is that usually the religious denominations, they were centers of science and medicine. For example, ancient Greece. In each and every Greek city in ancient times, it was a certain place for sacrifice. It was usually the temple for a certain god, for example, for god Athena or for god Apollon or Zeus. So, and usually next to it, it was a certain place devoted to Asclepios. It was a god of medicine, and his daughter Igea. And it was a center of, let's say, ancient hospital that was the people, the healthcare workers, they were providing these services, to help people. So what I would like to highlight that these religious denominations, they were associated with medicine. The same pattern we can see in ancient Egypt. The same pattern we can see in ancient Mesopotamia and also in India. And this pattern you will see throughout medieval times. If you remember, in medieval times, the priests, they were healthcare givers, and they usually they were one of the most educated population throughout the medieval times. So ancient Egypt, it was a domination of religious beliefs, and doctors, they were often priests. If we talk about the illness, why the illness was appeared, so the reason, the etiology of illness, it was due to presence of evil spirit or poisons in the body, and medicines based on herbal extracts, they were used in order to help to relieve the pain. So pharmacists, they used to prepare prescriptions or ointments, portions. So everything was based on herbal. You can see here grasses on herbs. So the diagnosis of the diseases. So all this information that we know, so we get through investigation of papyruses, if you remember, and also analyzing manuscripts in the ancient pyramids and artifacts, ancient artifacts. If you remember, there was a very famous and one of the most outstanding scientists, Henry Miller, who investigated the ancient Egypt and also the ancient Greece. So what we know nowadays, and it's evidence, so it was in ancient Egypt, they could examine of the pulse. They could examine by palpation. Do you know what is palpation? Examining by hands, and also simple bed testing diagnosis. And also we know that trepanning, it was firstly used in ancient Egypt, so making holes in the skull to relieve the intracranial pressure. It was practiced a lot in ancient Egypt. So here you can see my favorite picture. So the dentistry as an independent profession, it was dated from so we know already that in ancient Egypt it was existed, yeah? What can we see here in this picture? We can see here the prosthetics, dental prostheses that are placed in the space of missing teeth, yeah? And they are fixed with golden wire. Can you see here? So this is one of the example of dental prostheses that are used in ancient Egypt. So what are the prevalent diseases in ancient Egypt? So earliest evidence of tuberculosis, it was found there, leprosy, Hansen's disease, and poliomyelitis. So what kind of herbs they were used in order to help patient? So onions, garlics, they were believed to aid in endurance. For breathing problems, for asthmatic problems, raw garlic was used. Acacia was used for skin diseases. And we have to remember that all these procedures using ointments or special drops, everything was associated with spelling charms, specific spells of a healthcare provider. Usually it was a priest. Let me check messages. Also, we know that in Egypt, the procedure of mummification was provided. Have you seen the real mummy, by the way? I have seen by myself because I was born and raised in St. Petersburg. It's in Russia, yeah. And there is the biggest museum that is known worldwide. It's a Hermitage Museum, and I graduated from Hermitage School Museum, and it was like my second home. And there is my favorite hall in Hermitage Museum was when I was a kid. Yeah, it was a hall with ancient Egypt culture, because there was a real mummy. And of course I used to go there, and I was very interested all the time to check how this mummy is going on and everything is okay or not. So, and now recently I've taken my son to this hall, you know, and still this mummy is there with all the teeth, I should say, with all the teeth, and in the same condition. The mummification, the procedure of mummification is, you know, it's from the Persian word mum, that means wax. So it means when the body is wrapped and embalmed corpse, and then after the body looks like wax-like. Usually the pharaohs and the priests, they were mummified and they were put then inside after this inside of a pyramid. And there is a special procedure, yeah. So the body is washed, then it's salted, it's put it in the special liquid with natron. The natron had antiseptic these characteristics, and usually all the internal organs, they were put in separate vases or boxes, and yeah, they were removed, washed, and put in separate boxes. Usually the small onions, they were used instead of the ice. And yeah, this was the procedure, and it was washed. The body was washed thoroughly with natron, and then it was wrapped in linen. So Indian medicine, what we know about Indian medicine, about Ayurveda. So Ayurveda is the Indian medicine, is the science of life. This is the oldest known form of healthcare in the world, and now it is considered as a complementary alternative medicine. And I should say that many people, they found the solution in Ayurvedic medicine, and they believe, and there are very good Ayurvedic centers in India. So I will tell you briefly about it. So the basic premise is that the universe is a part of one singular absolute, and that everything that exists externally, it also appears internally. So there are 8 branches of Ayurveda. You do not have to remember the names. Don't worry, I will not ask you. So it is internal medicine, it is surgery, ENT, ears, nose, eyes, yeah, pediatrics, toxicology, one of the most important, purification of the genetic organs, health and longevity, and psychiatry. So there are theories inside of Ayurveda, yeah. So there is 5 elements theory, 3 body humors theory, and 7 body tissues theory. Oh, wait a second. Yeah. So we will talk about 3 doshas, so 3 body humors, because there are energetic forces that influence on state of a body and condition of the health. Yeah. So it's Vata, Pitta, and Kapha. These doshas, so statements. You can see here triangle. So they are providing the stability of the health, and based on prevalence of these 3 statements, the person might be affected of different diseases. So we will not talk about these details. It's not. I will not explain you the details. I will just upload then the presentation. Yeah. So if you are interested, you can read about it. Okay. So based on Indian medicine, how do we get sick? Because of underlying imbalance, and we have to restore the balance and help to create the lifestyle that imbalance will never occur. And that's why it's necessary to maintain health. Balance is the key of the long and healthy life. So there are 8 ways of diagnosis in Ayurveda, and there follows. So diagnosis by pulse, by urine, by stool, diagnosis of a tongue, the size of the tongue, color of the tongue, picture of the tongue. Have you seen geographic tongue ever? When the tongue is imprinted as a map. So you will see most probably later with the patients. So diagnosis with the speech, how patient present you information, how present speak with you, what are the patterns, what are the face expression during speech, diagnosis by touch, diagnosis by vision, I told you already, and by whole appearance. So Ayurveda focuses on exercising, on psychological balance, yoga, and meditation. And also very important is hygienic living. So maintaining hygienic patterns and lifestyle in each and every body parts, including, of course, oral cavity. So, ancient Greek medicine. Ancient Greek medicine has taken the roots from Egypt, from India, from China, from island of Crete. This is the biggest island, if you know, in Greece. So ancient Greeks, they believed in gods and in magic, and usually there is a joke that there were more gods than people in ancient Greek and also in ancient Rome. There were a lot. There were wars, yeah, not only external with different countries, but also internal wars in Greece. And also, if it's a war, yeah, the logic outcome is that there might be injuries, yeah, war injuries. So that's why since the development of medicine was not so proper, the knowledge was empirical. So the healers, they might resort to mainly to magical practices. As I told you, the god of medicine in ancient Greece, his name was Asclepius, and usually he is depicted with a snake, and also his daughter, her name was Igea, and usually she also in ancient manuscript, in ancient bas-reliefs, she's depicted behind him. So every large town in Greece, they had temple of Asclepius, so where pilgrims, they could stay night waiting for healing, and also healthcare providers, they could assist people if there was the necessary of providing the treatment and assistance. As I told you, the religious denominations and the religious beliefs, they were strongly associated with medicine and with science, and especially these patterns goes through ancient times, right? So the main principle of ancient Greek medicine was due to, first of all, Hippocrates. Yeah, if you know this famous ancient Greek doctor, and the main principle was do not harm. So one of the reason that there was a limit of knowledge in surgical procedures, it was a religion ban of the dissecting of cadavers. if you remember, later on in medieval times, Leonardo da Vinci, he had investigated a lot, and he depicted and made sketches and pictures about anatomy and physiology later on. However, in ancient times, we do not have this, people hadn't this deeper knowledge. However, they could, but it was a religious ban for investigation. What procedures usually they were used in order to help patients? So bloodletting, because blood was associated with life, and it was proposed with Hippocrates, and then later on it was systematized and developed by another famous scientist through that time, Galen, and it was, of course, used for centuries as a methodology of treatment. Couple of words about Hippocrates. So he, one of the most prominent doctor, worldwide, Hippocrates, and Hippocrates described cancer in different appearances, and also he described the face, the expression of face of a person who suffers from cancer. So here is an explanation. The expression of face, the nose is pinched, the eyes are sunk, the ears cold, retracted. So all these features, they were described by Hippocrates. And one of the most, let's say, most important achievement of Hippocrates, they were as follows: that he invented the principles of orthopedics, the principles of traction and counter-traction, the use of special springs for fracture, and he invented the special bench, the scamum, and that was used in tension to aid in setting the bones. So, medicine in ancient Rome. Actually, if you know the religions, beliefs, and the patterns in ancient Rome, they were approximately the same as in ancient Greece, but just one difference was that the gods, they had different names. But one of the biggest achievement of ancient Rome medicine in general is diet, hygiene, maintaining one of the best public health services in ancient times. So the biggest achievements is public health maintenance, prevention of germination and spread of malaria. They built Roman baths. So it was a, usually nowadays people, they have business meetings in cafe, or in offices, But in ancient times, famous politicians, senators in ancient Rome, they had meetings in Roman baths, and they actually had discussions there. Roman houses and streets, they had toilets, so they achieved one of the best results in cleaning hygiene. That's why everyone gives ancient Rome as an example as an example of the biggest achievement in public health. So about Galen. So Galen was one of the most influential scientists, medical scientists in ancient Rome. And he has written several books, mainly about surgery, because why surgery has developed so much during ancient Rome, because it was the ancient Rome emperor, and since there was a lot of wars, it wasn't banned for investigation. So Galen has this possibility, to investigate and develop this in this direction. So that's why he had a lot of work and books about surgery and about especially war surgery. So we have finished our lecture. So we had 3 parts. We had part of health psychology. We had part of screening, and we had part of history of medicine in ancient Greece, in ancient Egypt, India, and Rome. I will upload the presentations most probably tomorrow, okay? No worries, please, because you have more than enough time till the first midterm, and the study material from PPT on my side is more than enough. What else do you have? Maybe any other questions? Tell me. I will open the chat now. No other questions, So, okay, I think we can finish now. If you, please, you are more than welcome. You can text me mail. So you will have midterm not only based on my material. You will have midterm also with the material of Mr. David lectures, as far as I remember. Because the first midterm is after 6th lecture. So my material from PPT and Mr. David, but you have to ask Mr. David what material he planned to put in the first midterm. Okay? Wait a second, I will open the chat. So, wait. Yes, I explain again, from my material PPT. Okay? Based on syllabi, you will have the first midterm after 6th lectures. But please clarify with Salome Ciburdanidze. So she's DMD program, Doctor of Dental Medicine program coordinator. Okay? The schedule of the midterm, okay? Clarify with Salome. Not Salome Kiparoidze, please. Salome Kiparoidze, she's coordinator of medical program. There is some misunderstanding. So we have several Salomes. So Salome Ciburdanidze, I will text you here. She's coordinator of DMD program. So if you have any questions, you can ask her, or you can ask me. You can text me also, not only about introduction to dentistry, about dentistry in general, because I'm the program leader, okay? Okay, so can we finish now? Yes, okay. So till then, please stay safe, stay at home, take care of yourself, take care of your beloved ones, family members. So see you next week, okay? Bye. Have a nice weekend. Take care.